first, if she's on any other kind of like a YouTube or a Teams meeting, if that's still open, this will not work. So that happened to me yesterday. So just want to check that out.
Yeah, I actually went out of my
We're
login
live.
to my- yeah.
Okay,
I
so
can-
welcome to the Health Occupations and Long-Term Care Subcommittee meeting. We're all working virtually, and I've got a bunch of different documents in a bunch of different places, so please be patient with me as I try to move things along as efficiently as possible. We have 9 bills on our agenda today, so we have tried to organize them in a way that will keep as much moving as possible, as efficiently as possible. So with that in mind, we're going to take up the first 4 bills. Do not have any amendments. That'll be House Bill 95, 599, 210, and 182. It's my understanding that all the stakeholders for those 4 bills are in the room with us now. And then the committee should be able to discuss these and take action on them, at which point then we'll move on to a group of bills that have amendments, and we'll make sure those.
No, he doesn't.
Welcome, Delegate Saab. So the first bill we're going to discuss is House Bill 95, which is Delegate Krebs' bill. Lisa, can you remind us about what House Bill 95 does?
Tyler's, I think.
Oh, I'm sorry, Tyler, can you remind us about House Bill 95? Thank you.
My pleasure. House Bill 95, Health Occupations Nurses Delegation of Tasks. It would authorize APRNs to delegate nursing and technical tasks to unlicensed staff in appropriate circumstances, such as if the unlicensed staff member has certain training and it doesn't become too often a routine part of their daily tasks, and some other limitations like that.
And is Delegate Krebs here yet? Did she make her way here yet? This is her bill, so she may have something to say on it, but I know it had a lot of support. And oh, I see Delegate Krebs come in. Delegate Krebs, we're talking about your bill.
Oh, good.
Did you want to add anything about your bill? Delegate Krebs? I think she's on mute, and she's working her way off of mute as well.
I am off mute. I'm trying to get my picture up, but that's okay.
Sure, take your time. It's okay.
And listen, tell them in the future, if they would just announce a time, you could get back here and pick a time.
I know. We thought that we're going to be able to announce it from the floor, and Delegate Cullison and the chairman were able to do so, but they did not let them.
No, I know, but just if you have any influence, just tell them it helps to say, okay, this is the time. Anyway, this bill, are we live on this bill?
We are live, and we're discussing House Bill 95, and you can say whatever you want, and then we can see if there's anyone from the NP Association. I think we have someone here.
So I think this bill was pretty non-controversial. Just it sort of clarifies for the nurses what the assistants can do. So I think it's necessary right now just to protect them and what they can and can't do.
Absolutely. And do we have Dale Jafari or Kathy Ware or Donald Balasa here?
Dale Jafari's here.
Perfect. Do you have anything you want to add?
Nothing additional.
Okay.
I'm here also and nothing additional, but would be happy to answer questions.
Great.
This is Don Balasa, also nothing further, available to answer questions.
Perfect. So do we have any questions from members of the committee on the delegation of tasks for advanced practice nurses bill? I don't see any, but I'm going to give you a second to raise your hand in case they pop up. Does anybody want to move this bill?
I'll move.
I'll second.
Perfect. The bill has been moved and seconded. Any further discussion on the bill? All right. All in favor of the bill, say aye.
Aye.
If you need to vote against the bill, you can raise your hand in the participants tab. And it looks like it's passing unanimously. Congratulations, Delegate Krebs. The next bill is House Bill 599, which is my bill that I cross-filed for Senator Klausmeier, the long-term care planning bill. Joan Smith is here to just answer any questions on that bill, but again, a really simple bill that didn't have any opposition. Do we have any questions? Or wait, whose bill is that? Is that Tyler's bill? Lisa's bill. Lisa, can you give us 2 sentences on the bill?
The bill requires MDH to develop and publish materials to assist Maryland residents with long-term care family planning. The materials developed must be consistent with recommendations made in the final report of the task force on long-term care education and planning.
Perfect, thank you. Okay, any questions from the committee members on this bill? If you have questions, you can raise your hands. Otherwise, Joan, is there anything else you wanted to add on the bill? Thumbs up, I like that. All right, does anybody want to move the bill?
Move the bill.
Moved and
Second.
seconded.
Second.
Perfect. All in favor of the bill, say aye.
Aye. Aye.
Anyone who's opposed, make sure to raise your hand in the participants tab now. I am not seeing any hands going up, so it looks like we have unanimous support on that bill as well. Perfect. Did Delegate Bandari get here yet?
Yeah.
Excellent, wonderful. We'll move on to his bill, which is House Bill 210. I'm going to go with Tyler. Tyler, is that your bill?
Yes.
Perfect.
House Bill 210, temporary licenses to practice physical therapy and limited physical therapy. If enacted, House Bill 210 would establish a temporary license, good for up to 90 days, for an applicant who's completed all of the requirements other than the 2 testing requirements to become a licensed physical therapist. A temporary license would be temporary licensee practicing would still be under supervision while they're practicing. One question that came up in the hearing is why there's a transition in the testing schedule, and it is actually not the State Board of Physicians that made the change. It's the national testing body that only offers the test 4 times a year now. So that's why there's these 90-day gaps where you can't complete your license application. And so that's was the inspiration for this bill.
Excellent. Delegate Bandari, is there anything you'd like to add?
No.
Okay, I think we have Engin Wolford here also from the Board of Physical Therapy Examiners. Perhaps? Oh, there you are. You're on mute. We can't hear you.
You have to unmute. Yeah, see, it's fine. Yeah.
I think we need to make sure you're unmuted.
It's not showing mute.
Is that, it's not on our end, is it, Sharon?
Asia.
Well,
Yeah.
we can hear Delegate Saab though.
DLA pipe or whatever.
Well, now I see a mute on her. I'm gonna click ask to unmute, see if that helps.
Yes, I think.
She certainly has a lot to say.
Yeah.
So let's see if we have any specific questions on this bill. I think that it's a pretty clear bill. The fiscal note makes it clear that this is something that we need to move towards. Do we have questions from the committee on this bill? If you have a question, raise your hand. And if you don't have questions, it would be great if someone wanted to move the bill.
Move the bill.
Moved and seconded. Anybody want to?
Second.
Okay, Delegate Riley seconds. All in favor of the bill, say aye.
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 Anybody is opposed, make sure to raise your hand. Perfect. We have unanimous support on that bill as well. House Bill 210 passes unanimously. Thank you. I'm sorry we couldn't hear you, but you did a great job. Thumbs up. Okay, so the next bill, and I'm sorry, I meant to start the top of the meeting with this, timeline setting. So let me stop for a second. It's 12:26 now. This meeting is going to go until 1:15. So 1 hour for the meeting. We started at 12:15. I broke the bills out into bills with no amendments, bills with amendments that we need to consider, and then the 2 bills from last week that we want to reconsider. So there is still, this is the 4th of 9 bills on our agenda, but it has no amendments. It's the podiatry bill, House Bill 182. So I think we have stakeholders from both sides, so they can each talk for a minute, and then any member of the committee who has something that they would like to add can talk for a minute. We can have a discussion, but we do not want to take the whole hour on this because there are 5 more bills after this that also need our time and consideration. So, I do want to give this bill its appropriate amount of time, but I'm gonna go ahead and set a 10-minute timer because that should leave us with enough time to do the next 5 bills. So with that being said, is Delegate Kerr here? I'm not sure if he is.
I am here.
Oh, you are. Wonderful. Is there anything that you would like to say?
This bill involves medical professionals who practice podiatry, and they are be permitted to use the title of podiatric physician as it more accurately reflects their training, expertise, and scope of practice.
All right. Is that it?
Yeah, I think we've done this a lot. I think everybody understands the bill and what it intends to do and the arguments behind it on both sides.
I think that's a really good point. So who do we have here who on the bill? Do we have Bill Pitcher here?
Yes, ma'am.
Is there anything else you'd briefly like to add? And then we'll hear from Medkai as well.
Well, just to reiterate that after the session was adjourned early last year, the chair of the whole HGO committee sent a letter to the stakeholders urging them to try to work this out. We did, and weren't able to work it out. So it's just at a stalemate with that between the two parties. And we do have a couple of our members. Dr. Martirana is here, and Justin, the president of the association. I see he just got in, still in his scrubs. So hope they can add anything, or you can answer, or you guys can answer any questions of the committee.
Okay, yeah, I think we have Dr. Lewis and Dr. Martirana here. Did you want to say anything quickly?
No, I mean, everything we said was in the testimony, so I don't have anything else to add.
Okay, and just on the point that Mr. Pitcher just raised, obviously, those of us who have read the bill, it's really 2 words repeated over and over. So there's not a lot of space for amendment compromise in this. So I think that's why we're not going with our normal sort of let's get to consensus, approach in HGO that we like. Mr. Wise, did you want to add anything?
Thank you, Chairman Kelly. Just very briefly, if I can, I think you hit the nail on the head. This is one word, right? I mean, there's not a lot of room to maneuver here. We usually like to try to work things out, but there's just, not a lot of room to negotiate here. This was a sponsor-only hearing, as the subcommittee will recall this year, and I know you understand the issue, but in 30 seconds, the physician community believes that the term physician should be reserved for those who are trained in the entire human body through their residency. Podiatrists focus on the foot and ankle. There is even some statutory language that exists now in the podiatry statute that makes clear they're not to use terminology and so forth that would lead someone to believe that they are practicing medicine. And I think that's important history for this committee to think about before they vote on this change. And we continue to oppose the bill. I thank you for your time and happy to try to answer any questions.
Thank you. And before we go to member questions, it looks like Dr. Martirana does have something he would like to add.
Yes, I do. I believe it was Dr. Lorelei Ma that testified for MedChi that medical students study the entire body. Well, I'd just like to add that we study the entire body as well. We have 6 months of general anatomy, which covers the entire body, and then 6 months of local anatomy from lower extremities down. We also have microanatomy, developmental anatomy or embryology, and all the same basic sciences and many of the same clinical science courses that medical and osteopathic students participate in. So I couldn't understand that comment that Dr. Lorelei Ma made. I believe she really was not fully informed about the training, education training that we go through. We do serve side by side with our physician and OMD and DO colleagues.
Thank you for that. And it looks like we would like a minute for Matthew Dudzik and then any members of the committee who would like to say anything. Delegate Collison will be first. Matthew Dudzik.
Good afternoon, Matthew Dudzik with the Maryland Board of Physicians. I don't really want to speak to the training or qualifications of podiatrists because obviously they are incredibly qualified individuals. From a compliance perspective for the Board of Physicians, we already have an issue where we regularly receive complaints or licensure inquiries from members of the public who believe that podiatrists are physicians or are regulated by the Board of Physicians. Our main concern is that including the name podiatric physicians, will increase that. And of course, anytime we have to refer something to another unit, or we end up looking up an individual in our database only to find out that they're not in our database because they're not licensed by our body, it delays the compliance process for consumers in Maryland.
Thank you for that. Delegate Cullison.
Thank you, Madam Chair. So I appreciate the little extra burden on the board, but I actually think that burden is manageable. I wanted to ask one of the podiatrists if somebody came to you for podiatry service and they said, you know, I'm having this real problem with my elbow. It really hurts. Would you try to treat that elbow, or would you refer that individual?
Absolutely not. You know, when we talk about even a cardiologist, and you're a patient and you go to your cardiologist and you tell your cardiologist that your elbow hurts, your cardiologist should refer that patient to an orthopedist. So it's no different. We have our specialties. We understand the entire body. Gout is a systemic disease that affects the entire body. We see it in the foot. We know that we can treat the foot, and guess what? That patient should be sent to a rheumatologist. An orthopedist should do the same thing. So we understand the entire body. We all know our limits and what we're allowed to do and capable to do and what we're educated on, but that involves every specialty. Every specialty should know their limits.
Thank you, Doctor.
Sure.
All right. Any more questions for these folks from the committee, or anybody on the committee want to, Delegate Riley, go ahead.
Thank you, Madam Chair. Yeah, I do have a question. I did, I do reside in Harford County, and I have a letter of opposition from the Harford County Medical Association in Bel Air. And I was reading over it, and there was one question that I'm sure either Steve Wise or one of the others could answer. At the bottom of it, it says, if this would pass, then podiatric physicians should be licensed and regulated by the Board of Physicians. So that's my only stickler point. Are there other specialties, like the doctor just mentioned, Justin? Are there other, like you mentioned, a cardiologist? So, or is he considered a physician, and is he licensed as a board physician, since you used him as an example? Or
so to answer your question, and I know they brought up the Board of Physicians, COMAR states that a physician is an MD or a DO, and those are regulated by the Board of Physicians. This bill does not change COMAR. It does not change the definition of a physician in Maryland, which states it's an MD or DO degreed provider. This bill changes the word podiatrist to podiatric physician. Now, if this bill was a more involved bill where we were trying to change COMAR and change the definition to a physician to include our degree, then I can see that they would have an argument for that to place us under the Board of Physicians. But this is completely separate. So we are currently regulated by the Board of Podiatric Medical Examiners. We have our own board that does our licensing, our disciplinary actions as well, and other inquiries.
okay, but are there other groups that are actually considered physician? I mean, is this unusual that we're asking this? Is this the only group? I'm fairly new on HGO last year, so I'm not real familiar with all those, those specialists that are currently not physicians, but yet have asked to be physicians.
Yeah. So the chiropractors have their own board as well. Okay. They are not designated as physicians, and they do not fall under the Board of Physicians now.
Okay, thank you.
All right. I don't see any more questions from
Matthew.
I'm sorry?
Matthew
I'm
has a
looking
question.
for questions from members of the committee, but I'm not seeing any more questions from members of the committee. I see one from Delegate Kerr.
I'm just, if we're done discussing it, I'd like to move the bill.
I second it.
The bill has been moved and seconded by Delegate Bhandari. So let's discuss this among the members then. Go ahead. Who is that?
I was just going to ask, I've seen Steve Wiseman with his hand up. Is it possible he could answer my earlier question?
Yeah, let me do a time check. Hold on. So we got an answer from the podiatrist, and we're trying to get an answer from MedChi as well. So I'm going to put a new timer on 5 minutes, guys. That's my final offer. Steve,
Thank
go ahead.
you. Thanks.
I'll be very quick. Thank you, Chairman Kelly. All physicians are regulated by the Board of Physicians, regardless of specialty, cardiologist, OBGYN, you name it. I think the argument advanced in the Harford County letter is that if the argument made by the podiatrists is that they are equal to physicians in education and training and therefore entitled to use the term physician, then it would make sense to move them under the Board of Physicians, both from a efficiency standpoint, but also so they're subject to the same regulation as other people using the term physician.
All right. I don't know who Justin's iPhone is. I think that's a podiatrist,
Oh,
right?
sorry, that's me. Yep.
Okay,
The only
we can put another bite at that apple and then we'll go
Yep.
back to the committee
this
discussion.
this is the last part. 36 other states designate us already. I mean, 2/3 of the United States of America recognizes this. There's been no other issues. There's been no controversy. The time has come. I mean, it's trying to be progressive and to acknowledge we don't want to be the 49th state, the 50th state to acknowledge this. I mean, you know, a lot of people don't want to be the first state to acknowledge it, but you definitely don't want to be the last. I think, you know, having 36 states already, you know, it just shows that this is acceptable and it's acknowledged. And we just asked, Maryland's the 37th state. That's all.
All right, and with that, I want to focus now on the discussion from the committee and just, you know, clear expectation setting. Nobody's twisting any arms on this vote. We're going to do a roll call vote because I know that the subcommittee is divided. So, you know, that we can have a discussion and then just feel free to vote, you know, what way you want to. Obviously, that's always the case, but I just want to make it really clear. We're just going to do a roll call vote and the motion was favorable. So if you support the bill, you're going to say yes. And if you don't, you're going to say no in the roll call vote. Is there any members who have anything they'd like to say during a discussion of the committee members?
Madam Chair, may I be recognized?
Yes, Delegate Lewis.
Thank you. Thank you to the proponents and to everyone for the discussion. I am among the few people in the legislature who knows anything about medical training. My good colleague, Delegate Hill, is a physician, which means she has an MD. And across the street, we have Senator Lamb, who's a physician. He has an MD. And I spent a little time in medical school working towards an MD, but made other choices and didn't earn the MD degree. I know a little bit about what the training entails and the sacrifices and the specialization and the quality of students and the scope of work. I also been lucky to enjoy services of excellent podiatrists in my time and value their expertise as well. I will be voting no on this, and I think it's important, whatever other states have chosen to do, that in Maryland, we maintain a clear distinction of what these different professionals do, and that we not confuse the public and open the door to difficulties in oversight, regulation, and similar matters. So I just wanted to make that clear, if that's okay. Thank you, Madam Chair.
Absolutely, thank you. And we're going to hear from Delegate Bandari and then Delegate Saab. Delegate Bandari.
Thank you, Madam Chairman, Chairwoman. With the due respect, I believe that, you know, this podiatric physician or surgeon, they're qualified by their education and training to diagnose and treat condition affecting the foot, ankle, and related structure of the leg. So I think they know the body. When I do the research, this is one of the highly debated issues last year too. So that is the reason why I'm supporting, because that is known as our body system, lower extremity, you know, so that's important as well. That's a part of our body as well. So that's why I'm voting for the bill.
Thank you. Delegate Saab.
Thank you, Madam Chairman. I'm actually not, I have a couple questions on, if you can go back. So which board will be regulating them? Would it be the Board of Physician, or what board would be regulating them?
The podiatry board will continue to be their board.
So this is what I'm actually struggling a little bit with the, with which board should regulate them, because shouldn't the Board of Physician regulate them if they want to be called physicians?
I think that that's kind of a red herring, honestly. I mean, I don't want to, I mean, maybe someone else can answer to that, but oh boy. Sorry, we're getting texts from advocates who need their bills moving, so I apologize, but does any member want to answer? Does anybody member want to answer that or have a comment on that, or the sponsor perhaps? I know that the podiatrist wants to weigh in, but this is we're
Okay.
really trying to help her only.
Yeah.
Looks like Delegate Cullison maybe has an answer to that.
Well, I was going to suggest that if as long as there is a board of podiatry that is regulating them based on their specialty. I mean, theoretically, we could have a board of cardiologists, a board of nephrologists, a board of whatever's. We could have boards for all of those specialties. We don't, and it's probably based in some history, as is the separation of podiatrist. So from my perspective, as long as we know that there is a board that is regulating them, that is licensing them, that is based in the rigorous standards that we set in Maryland for our healthcare professionals, you know, other than the Board of Physicians sometimes having to field a call around an issue around a podiatrist, and they say, well, that's by the Board of Podiatry. Here's their number. There isn't really any difference in what actually happens in Maryland around this. Does that help?
I think so. Do you mind if we hold this, hold the vote for maybe one more week so we can just discuss it with board? I just want to make sure that, you know, it just goes to the right board.
Yeah, we can hold this for 1 week, as is the committee policy. So we'll bring it back. It'll be to the next meeting. I assume our next meeting is next week. If we get an onslaught and have a meeting before then, we won't have a special meeting just for this though. So I do see Delegate Krebs has something that she wants to say. So did you still want to, if we're going to hold this until the next meeting, Delegate Krebs?
Just very quickly, I mean, I don't think people are confused, and I certainly do not want to see the Board of Physicians have anything more on their plate. They've got too much on their plate now. I don't that I mean, some people call doctors, some people call them physicians. I call them doctors. So I really don't think that the people really care. As long as people are working within their own scope of their practice and their training, I don't think this nomenclature matters all that much. It certainly doesn't matter to the public. And I do not support putting them in a board with physicians. I think they're where they need to be, and we need to take more off the Board of Physicians' plate if we could. So I support the bill. And I see no problem with it. And I don't think it's going to change anything. As long as they work in the scope of what their training is, which they do, this is a lot to do about nothing. Thanks.
No, thank you. I don't see any other members with their hands raised. So we went a little bit over the time, but I think this was a good discussion. And we will come back to this bill the next time the subcommittee meets and have another discussion and a roll call vote. Sound like a plan? All right, so we will come back to 182 at the next meeting. Now we're moving into 3 bills that have amendments that seem to be consensus amendments. So it's going to take a minute to get the right folks in the room. So we will start with House Bill 161, then we will move to House Bill 207, and then 554. For 161, cannot remember. I think that's a Lisa bill. Is that a Lisa bill?
Sorry, it's Tyler bill.
Darn it, so close. Not close at all. I had a 50-50 chance. Tyler, can you remind us about that bill?
So if the amendment is adopted, HB 161 would provide for the licensure of audiology assistants in the state. As drafted, it was for registration, but there was an amendment to be offered that would transition it to licensure and then make some following changes with section number references throughout the bill as well.
Great, and this was my bill. So the amendment has the support of the Professional Association as well as the board. We have Dr. Alicia Spoor with the Maryland Audiology Association, and I think Candace Robinson from the Audiology Board are both here. Do either of you have anything to add?
I do not. We're fully in support of the amendments. And I'm on a different computer, so I think you can see my face now.
It's very exciting. We can, yes.
Thank you, Delegate Kelly. MAA is in agreement with the amendments. We don't have anything further to add either.
Okay, so I'm going to move the amendments so that the committee can discuss the bill as amended. Move the amendments. Anybody want to second it?
Second.
Delegate Collison, second. Okay, all those in favor of the amendment say aye.
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 Anybody who's opposed, raise your hand. I don't see anybody. So the amendments are adopted on the bill as amended. I'm going to move the bill as amended. Anybody want a second?
Second.
Okay, so any discussion on this bill or any questions for the stakeholders who are here? If you have anything to say, you can raise your hand. Perfect. All in favor of the bill, say aye.
Aye.
Anybody who's opposed? I don't see anybody opposed. Bill passes. Perfect. So next we have Delegate Wilson's bill. He was not able to join us because his subcommittee is also meeting right now, but he was able to work with Dana Kaufman, who's still here. Hi, Dana. I didn't know you were still here. Okay. So Dana Kaufman is here and they worked together on an amendment. This is a Lisa bill, right? Yes. Lisa, can you remind us about the bill?
House Bill 207 specifies that a nursing home consistent with state and federal confidentiality laws must notify a resident and, if applicable, the resident's representative or interested family member within 24 hours after specified changes in the condition of the resident. There is an amendment on page 5 of your packet, and in that amendment, it alters the time frame for the notification from 24 hours to immediately and includes decisions to transfer or discharge a resident to the reasons for notification.
Okay. I'm just reading this note in the Zoom. Feel free to leave the Zoom if your bills are done. So the bill has an amendment. We have Dana Kaufman here to explain it if anyone has any questions for her. Is there anything you want to add, Dana?
The only point that I would make is with this amendment, the bill aligns with federal law. And that is always the issue that I'm most concerned with is when federal law addresses an issue, but state law also does it, the need for consistency between the two. So with this change, the two laws are consistent now.
Excellent. And I think Erin Greenfield and Margot Quinlan both signed up. Are either of them here? Not sure if they are.
Can we move the amendment?
Yes, perfect. The amendment has been moved. Anyone want to second it?
Second.
Moved and seconded. All in favor of the amendment, say aye. Aye.
Aye.
Anyone opposed?
Move the bill as
Move
amended.
the bill is amended.
Second.
Excellent. All in favor. Oh, any discussion on this bill? I hear crickets. Okay. All in favor of the bill as amended, say aye. Aye. Anyone opposed? No. Thank you so much. Okay. So the bill passes unanimously. The next bill is Delegate Pena-Melnick's bill, which is 554, Assisted Living Consumer Protection. There was some good work that happened on this regarding an amendment as well. Lisa, do you want to get us up to date on that?
Yep. This bill requires an assisted living program that was appointed as a representative payee for residents to report specified information to the Consumer Protection Division of the Office of the Attorney General by June 1st of each year. An assisted living program must report on the use of the following: the Social Security benefits and other federal, state, or local government funds. There's an amendment on page 2, and the amendment clarifies the requirement that OHCQ refer an allegation of an unfair, abusive, or deceptive trade practice by an assisted living program to CBD and the Office of the Inspector General within MDH.
Awesome. And I think here on this bill, we may have Tammy Brejnahan. I'm not sure. Eric is here from the Alzheimer's. Eric, do you have anything you want to add? Eric, are you muted?
I don't have anything specifically on this bill. I would just say that continued oversight to both stabilize the assisted living facility industry and protect its residents is essential.
Excellent. And does anybody see Tammy on here? I don't see her. Pat, you worked on the amendment with Delegate Pena-Melnick, right? Would you like to talk about that for a minute? Except you're on mute.
Can't hear it,
Pat, you're on mute.
but I don't think she is.
We're not able to hear Pat O'Connor. It's too bad because I bet she's got something interesting to say. She likes the amendment. I know I spoke with Delegate Pena Melnick earlier. She said they had a very productive conversation and came to agreement on the amendment. Okay, Lisa, is there any way you can describe to us what the amendment does since we can't hear Pat? I mean, I know you just did, but just give us a sentence. No, okay.
No, I mean, it's just a clarifying amendment at this point. It's just making sure that the notification from OHCQ, if there's any fraud, goes to both the Consumer Protection Division and to the Inspector General.
Perfect.
It's really just clarifying.
All right, I'm going to move the amendment. Does anybody want to second it?
Second.
Moved and seconded. Any discussion on the amendment? Perfect. All in favor of the amendment, say aye.
Aye.
Okay, anyone that's opposed to the amendment, note yourself in the participants tab. And then on the bill as amended.
Move the bills amended.
Second.
Moved and seconded. Any discussion on this bill? All right. What do? We vote. Okay. All in favor of the bill, say aye.
Aye.
Anyone who's opposed, please note yourself in the participants tab. Looks like it's passing unanimously. Thank you, Pat, for working on the amendment. That's great. I wish we could hear Pat because I know we wanted to talk about House Bill 135, and I think there is an amendment there. We're going to need to bring in some new participants, I think. So let's take a second. And I know what we have left on the agenda are the two bills that we did not finish last week. One is House Bill 141, the Residential Services Training Bill, and the other is 135, the Injectables Bill. So while we're getting folks in the room, and if your bills are done, feel free to leave except for committee members. It looks like we've got 20 minutes left for our meeting time. So just to give members a little time frame. Yes, Delegate Collison.
Thank you, Madam Chair. I was wondering if Pat O'Connor might leave and come back in, if she could get her volume going then, because she's not on mute and yet
we're not hearing her.
Right. So if you try again, maybe.
Or you could call in from a phone.
Call in on the phone. Okay, thanks.
We'll give her a minute to get back up, and we can talk about the RSA training bill, House Bill 141 first. So if the committee remembers, I think we forwarded some questions on the fiscal implications to the Department of Health, and we had some kind of updates. Lisa, do you want to get us up to speed on that bill?
What do you want to?
So we sent an email, right? We got some kinds of responses. They were not.
We have very specific questions. The answers we got back were a little bit more general, but basically the MDH is sticking by their fiscal note, and they're saying that that's an estimate of what it's going to cost, that it's going to be the 25% rate increase. DLS, is saying they can't dispute if MDH says they're going to charge that. They can't really come back and dispute it.
And so from my understanding of their messages, was basically that the rate is going to go up in order to offset the hours needed for the training, because that's not time spent in direct care. And they also noted that their estimate didn't take into account increased service utilization over a few years. So it was a little bit of back and forth. Like we didn't, we said to them, did you count this? Did you count that? And they're like, well, we didn't count this. So there's a little bit of that going on. We're not going to get any more specific information than what we have. So I think the committee is just going to need to make a call on this. That's where I think we're at right now. But I would be happy to hear from the sponsor of the bill and the stakeholders for a couple minutes. And let me look at the clock. So we have 15, 18 minutes. So we'll do 9 minutes on this bill. I think we can do the last bill pretty quickly. Delegate Sample Hughes?
Sure. Thank you, Madam Chair. And you're accurate in your assessment. I have the emails as well from DLS. So not to rehash exactly what Lisa just stated, that is the exact information that I have received, that 25 cents is where the rate is with Medicaid. So to that end, that's the extent of my information.
Okay. Do we have any thoughts from there's no amendment proposed on this bill, so we could wait. Oh, go ahead.
There is an amendment, sorry.
Oh, we didn't put the amendment on last week?
Well, that's
I thought we put the amendment on last
We
week.
might have, you're right.
There's no new amendments.
No, there's no new amendment.
Yeah. So we're just gonna need to make a
You're right, we did adopt the amendment, you're right, sorry.
So we're gonna need to make a decision. Any thoughts from members of the committee? I know that in the discussion last week, there were a number of committee members who felt this was, a real priority for us. Anybody have anything they want to say? Delegate Krebs.
Thank you, Madam Chair. This is a really important bill. My only concern right now, and having a mother-in-law in assisted living, it's a really challenging time for them. Many of them have reduced capacities because people are taking folks out or they're not letting new people in. They're having trouble with staffing just because of the pandemic and just getting folks in there. So, and our rates all are just going up because of that. So I'm very, very sensitive to the assisted living, and it's all private pay. So I'd like to hear what the industry has to say. How do we make sure this happens in a reasonable way that's not going to put pressure on costs? Because I'm telling you, it's barely affordable for somebody to stay in assisted living. It's not something covered under Medicaid. So I'm very sensitive to the price pressures at this moment on our assisted living providers. But I also am sensitive to the need for proper training for dementia. So how do we find a balance?
And I think we can have Eric answer that question, but I know from my perspective, I think we did, there were a lot of changes to the bill this year looking exactly for that balance, which is part of the compromise that took place when industry came to the table. So let's hear if Eric has an answer to that, and then also Dana. Eric?
Dana.
Oh, and Dana, yeah. Eric had his hand up to answer, so.
Yeah, and I want to thank Dana because she worked really hard and brought her members to the table for this bill about the home care industry. And the bill reflects compromise on both sides. It provides, in contrast to last year, fewer training hours, more flexibility to reduce costs, ideally in how the training is provided, in terms of allowing supervisors to provide the training, allowing the training to be provided online, and has as well for the training, focused training topics. So with those core 3 areas put into place, fewer hours, focused topics, and more flexibility, we feel that the costs of this, as stated, will not be as significant, will not result in significant added costs for providers. And we appreciate Minka's urging support for this bill. It was great, and appreciated Joe D'Amatos as well chiming in last week and stressing the when we last met about the importance of supporting this bill. And we'd ask for your support because we think this is the right thing to do.
All right, let's hear from Dana.
Thank you very much. And just to add to what Eric just said, Delegate Krebs, I appreciate your comments regarding the assisted living industry because that has been such a concern, is trying to stabilize all of these industries during this pandemic. But just to let you know, this bill actually refers to residential service agencies, not to assisted living.
Okay.
So assisted living is not directly affected. Some of their residents do use residential service agencies for various reasons, but it is not a direct impact on the assisted living communities.
Thank you for clarifying that. Is there any way we could do some type of a report back or a sunset, not a sunset, but a report back to show the yes, what we wanted to occur has actually been occurring and it's been productive?
Well, first of all, I think one of the things that did acknowledge the pandemic is that it does have a delayed effective date. So we can get the trainings up and running, and also for, again, to stabilize all the industries. I'm not exactly sure who would be able to do that type of study. It is going to be part of the personnel files for any type of complaints or inspections by OHCQ. But I do think that because of the compromises that we made, that this is a good bill to move forward with the amendments.
It's possible we could do some sort, request a fiscal impact sometime out, right? Like, I mean, that's the only really remaining issue, right? Is what are the costs of having the state? What's the cost to the state of doing this, right, Delegate Krebs?
So this is all state money. There's no private money involved with this in any of these residential service agencies?
No, it would be both, because residential service agencies do have both private pay and Medicaid. The cost on the fiscal note is for those who are recipients of the Medicaid dollars, the clients who are Medicaid recipients. So
private pay are going to have the same impact.
Yes, the training will be the training for anyone regardless of pay source.
Okay.
Okay. So do we have any more? Delegate Bandari, is that your hand up? Delegate Bandari.
I would like to move the bill.
All right, the bill has been moved. And does anyone want to second it?
I can. Second.
Delegate Lewis moved and seconded. All right, any more discussion on the bill? I don't see any. All in favor of the bill, say aye.
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 Anybody who's opposed can note themselves in the participants column. I think we did our very best to try and quantify the costs of this, and we can only work with what we have. Really appreciate the industry coming to the table and acknowledging that even though this may have costs, it has tremendous value. So thank you. Thank you. Passes unanimously. Great job, team. Now, how are we doing on the Pat O'Connor project? Can we hear you?
Can you hear me?
Yes.
Yes. Thank you. Thank you.
Okay, so we have the House Bill 135 injectables bill. I'm going to say that's a Lisa bill. Is it right? Am I right? I don't know. Lisa, that's your bill? Yep. Okay. Can you, I'll remind the committee, we discussed this bill last week. We had a robust discussion. We had some things to work out. How are we doing?
Chair Kelly?
Yes.
Kelly, may I interrupt? Are you aware of the recent development?
The coming together and joyful compromise that HO is always trying to accomplish. Yes. So I'm not sure if the committee members have a copy of that amendment yet. Lisa, do you know?
I'm not even aware of the compromise, so I don't know what.
So, would you like me?
So let's hear an update from the sponsor and from Pat, because that will keep us moving. Delegate Young, do you want to start?
Sure. This bill is a repeat from last year. It passed unanimously in our committee on the floor, but no good bill goes without an amendment. So this year, new issues surfaced, in particular from the OAG's office, and we have reached a compromise. And basically what that compromise says is that the board jointly with the State Board of Physicians, the State Board of Nursing, and it adds the Consumer Protection Division shall adopt regulations establishing standard procedures. Let Pat elaborate on the second part, and I see Aaliyah wants to speak as well. So amendment technicalities and compromises are probably not my area of specialty, but I will refresh the subcommittee that what this bill does is allow pharmacists an expanded ability to administer injectables, and those injectables are predominantly from individuals who are suffering from mental illness and addiction. So this bill, which also became an emergency bill, is even more important today than it was this time last year. Thank you.
Excellent. And let me just touch base with Lisa in terms of process. We have the language, but it's not in folks' packets, so they don't have it in front of them. Could we adopt it anyway, since it seems to be help, or should we wait until we get it in front of them?
I'm still a little unclear of what it is, partly because I can't find my bill.
It's, we had a lot of bills on the agenda today. I would like to commend the subcommittee for doing a good job. I'll come back to you on that question, and we will let Aaliyah Horton say something, and then Pat. Oh,
can we just get a clarification though? I heard something about adopting amendments, and I believe the HEAU was going to be involved in draft. I'm sorry, in regulations.
Let's
So
hear
if
from
I-
Pat first, then, and then we'll hear from Aaliyah.
So directing attention to page, it's House Bill 135, page 4, and line 6. And this provision currently allows, on or before September 1st, 2022, the board, jointly with the State Board of Physicians and the State Board of Nursing, shall adopt regulations establishing standard procedures. They then list a variety of procedures that are to be addressed. We want to thank the sponsor and the proponents. Thank you, Aaliyah, and your colleagues for suggesting that in lieu of accepting our amendment to put a notice in the statute, we diverted instead to the regulatory process, which we concur with. We in the Consumer Protection Division are subject matter experts in price and payment notifications to consumers. That is why we would like to be included with these stated boards for the purpose of the one category proposed by Delegate Young and the proponents. And that category is for information about payment. I'll let Aaliyah provide the exact language. Now, while muted, I did see an email come in from Aaliyah a few minutes ago suggesting that the phrase be in consultation with, and if I may respectfully object, it's very important to the division that we be involved with the three boards. These are payment and notice issues. We are the subject matter experts in that, and we defer to their judgment on all of the other issues that we don't need to be involved in. So we proposed a breakout. We do want to be not merely in consultation with, but we want to be involved with the three boards as co-equals on this single category of regs. Please.
Okay, so it sounds like we don't exactly have consensus on the amendment yet. Aaliyah, why don't you get us up to speed?
Yeah, so we agreed that the issue can be addressed in regulation. So I think that's where the major agreement is. There is concern, but there is concern for my members about adding another entity to the in jointly. When you start adding all of these different agencies as having to develop the regulations jointly, it just creates delays. And so my suggestion was to keep the language, add the amendment about the notification, which I think we've agreed on that line item, but just add, and in consultation with the Consumer Protection Division, to the list of groups, because we've done this before in regulations where it's been in consultation with different entities, with other stakeholders, and the boards follow that and include whomever else needs to be included in the conversations. But adding the jointly means that everybody has to then approve every single thing. And I just don't think that that's necessary for this portion to address this issue.
Okay. So we don't have complete agreement on this, and I am seeing, we have 3 minutes left of our meeting. I do want to remind the committee that last week when we discussed this, we had some questions from Maryland Right to Life. It looks like they have some stakeholders back this week. So I think that, do you guys want to have anything else to add from last week's discussion? Or is there anything we need to talk about there? Is that Katie Glenn, I think?
Okay.
Or Laura Bobley, is she here?
I'm Katie Glenn. I'm representing Americans United for Life, a nationwide legal organization, and Maryland Right to Life, speaking to our continuing concerns on HB 135. One of our issues is that it seems that self-administered medication and injectable has been conflated in this conversation. The way that the bill is written, these are two clearly different categories. Injectable is defined in the bill. Self-administered medication is not, although it's defined elsewhere in the Maryland Code. It could easily be redefined through the regulatory process to take on a new meaning that is not what is supposedly intended by this bill. And so I think that we would feel much more comfortable with an amendment that clearly defines what a self-administered medication is under this bill, to ensure that it would not eventually include mifepristone, which is the chemical abortion pill. This is a drug that in other states and by the NHS has been described as a self-administered medication abortion. So it's not outside the realm of possibility that that phrase could be redefined later. We think that this needs to be defined. Second, that if it's not, then it opens up Maryland pharmacists to serious rights of conscience violations if in the future they are being thrust into chemical abortions being distributed through the pharmacy system. So happy to work with anyone on this committee on that amendment, just clarifying and defining what a self-administered medication means under this bill. Thank you.
Okay, this sounds a lot like the conversation we had last week. Leah or Robin, who wants to? Aaliyah?
Yeah, so this bill amends that section, and so it doesn't make any changes to the definition of self-administered. And frankly, any medication that comes out of a pharmacy in oral form is a self-administered medication. And I'd just like to defer to, I do have one of the pharmacists, Megan Arrett, on the call, and she can talk about that specific issue and the conscientious clause that is actually currently in Maryland statute.
Thank you. And again, this does seem very familiar. I don't want to have the same conversation next week. So this is the last, like if someone wants to put in an amendment, we can vote on an amendment, but I don't want to every week have the same, it feels like Groundhog Day. Megan.
I completely agree. This is a self-administered medication. It's an oral medication. Pharmacists aren't going to be administering this medication. If it's written, then they dispense it. I don't see how we could get wrapped up in something. Additionally, if pharmacists are not comfortable dispensing it, they currently in regulation do not have to dispense it. They can send that patient to another pharmacy. It's the exact same question. So I'm not certain what we can do with it.
Okay, let's hear from Delegate Krebs because she has a question. Delegate Krebs.
No, I said, we got the Attorney General's opinion from Delegate Kipke had requested it, and it clearly says in there that it is their view that it would not make it any more available for abortions. And Katie, is it Sarah? I guess Sarah. Oh, no, Katie's over here. You moved spots on my, and you both have the same kind of colors on. If you have some kind of amendment that you'd like to offer some language, we would certainly consider it. But right now, it doesn't seem like what the Attorney General says and what's just been described to us that it is possible. So either if you have some language or words that you'd like to propose, that would be great if you think that would make it more clear. But appreciate having the Attorney General's opinion and the explanation that is given to us.
Okay, I'll send that. Thank you.
Wonderful. Anything else from the committee? We're 2 minutes over, but I really wanted to try and get this bill out if we could. It sounds like we are not in complete agreement on what the amendment needs to look like yet. I hate to. I'm sorry.
I can work with Pat and
Mhm.
And Elia
Right.
nail down that before next week.
Right. Well, and if it would clarify or move things along, I think it's important to remind the committee and stakeholders, the Consumer Protection Division has statutory authority over this same space, as do the boards, the professional boards who will be addressing the patient safety issue. So we have direct regulatory authority. We could theoretically, on our own, embark on the, this regulation setting process. That would not be an efficient use of resource, and it's a better way to work with the boards. But it's very important to the division that we maintain quality control over the space in which we have the regulatory authority, which is this space.
I know that some members have to leave, so by all means leave. We're just wrapping up the meeting. I'll keep you updated on anything that happens. So that was the last word from Pat O'Connor. Aaliyah, did you have anything else to add?
I mean, I understand that. And if that is the regulatory authority for that division, then they should do it for all of the health occupations and not just on this one statute.
Okay, so let's work on this over the next couple of days. I'll remind the committee that we passed this bill out last year, and it does really important things. So let's find a way to get this bill moving. And thank you guys for all of your hard work on it. And thanks to the committee for getting through a really robust agenda this week. I really appreciate all of your cooperation and team spirit. Thank you. Have a good day.